Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel. Welcome to Q&A sessions, Monday Q&A sessions, I should say, where I answer your direct and specific questions. So if you do have a question that is direct and specific to a situation that is not diagnostic in nature, feel free to email it to me at info at oh my God, I can't remember my domain name, drzphd.com. The email is in the information box underneath this video, or you can comment underneath this video and let me know what your question is, and I'll snatch it and put it in a Q&A folder. Keep in mind that for everybody who send me questions, if you get any response from me saying, great question, I will do it in Q&A, know that I snatched your question. If it's been some time and you haven't gotten a response from me, chances are I either missed out on your question, and I'm really sorry for that, or YouTube has been lately, I don't know what the deal is, removing, deleting, altering comments being placed on the platform. As always, I have selected 6 random questions. I haven't looked at them yet, so we'll see what they are about once we dive in. I have blacked out everybody's name for privacy, and I have created timestamps below for everybody to follow in case if you want to jump around. So without further ado, let's get started. First question for today. Hi, Dr. Z. As a trans person in the face of transphobic legislation, I realize my anxiety has escalated. What advice do you have for trans people in the face of so much hate? How do we, the trans community, help each other? This is an excellent question, and I actually going to make a separate big video about this, how it's affecting you psychologically so that you can be aware of it, pay attention to it, and also the ways you can cope with it. The anti-trans legislation that is happening especially in regards to minors, to children, to youth, and also starting to bleed into care for adults, affects everybody, regardless whether you're adult or you're minor. It doesn't matter, because a threat to one part of the community is going to feel like a threat to all of us. And it is inevitable that anxiety and depression is going to increase exponentially for a lot of you. Even if you don't daily engage with this content, even if you avoid news, collectively, it's still going to impact you. In the face, as you say, so much hate, how do we, I like that you say we trans community, I like how you make it more communal, help each other. One of the things that I highly recommend for everybody to do is to set boundaries for themselves in regard to the content that they engage with. If you are prone to seeing news or reading news constantly, can you step away from it? Can you be maybe more selective about what you read? When you see people hatefully commenting on Twitter, on this channel, anywhere else, the minute you see it, try to move away. Don't engage in dialogue, because that's a rabbit hole. It's almost like, remember that video I did on how to deal with people who are hateful, the analogy of people who can't control their feces. Every time you engage with hateful comments, you're stepping into that pile of shit and you're dragging it around, and it stinks. So first and foremost, boundaries for yourselves are going to be very, very essential. Now, how do we as a trans community help each other? Stick together. By sticking together, we amplify our supportive energy, we amplify the positivity of the trans community, the resilience that is embedded in trans community, and the way that you can be part of a trans community, even if, and I know that it's not for everybody. I know some people go to trans support groups and they feel like they can't resonate, but there's so many different ways you can be part of a community without actually going to support group. Everybody who subscribed to this channel, and if you're not subscribed, I don't know what you're waiting for, you have to subscribe just so you can at least support an ally in trans community. Anybody who is subscriber to this channel, by being a subscriber, you're increasing the number of subscribers on this channel. Therefore, YouTube pushes this channel in algorithms to help others find this information as well. You can do the same for other allies. You can do the same for even trans advocates out there, people who are on social media, people who put out podcasts, people who are publishing books, people who are public speakers, who talk on this type of issues, who amplify your voices, who have platform to do it. If you yourself don't have platform to do it, let's elevate people who do have platform to do it. And that's another way that you can help. and be part of the trans community. It doesn't have to be becoming advocate yourself. It doesn't have to be, like I said, joining a local LGBTQ community, although you can if you want to. It can be as subtle as, hey, you have an Instagram and you see another person who's on Instagram who is sharing mindful, insightful, helpful information, or dispelling myths or hateful messages that go around trans community. And by just subscribing to their Instagram page, you are supporting them. And by doing that, you're supporting everybody else. So there's a chain reaction. So I would say that's another thing, is be around people who elevate. Apart from just trans community, I'm going to say this. Right now, surrounding yourself by people, by figures, public figures, speakers, podcasters, motivators, social influencers, who are all about elevating people up, leveling people up, positivity. And I'm not talking about the toxic BS, fluffy positivity, legitimate conversations about helping you push through the challenges, helping you push through the struggles. Surrounding yourself by those voices is going to help you psychologically stay in a positive state of mind. Every time I doing something mindless, washing dishes, cooking dinner, putting makeup on, things of that nature, I make sure that I have podcasts on that influences me in a positive way, from which I can also learn something. So that's another way, but sticking together is going to be imperative. So let's all stick together and help each other and support each other. By the way, anybody who comments underneath any of the videos I produce, you also, by doing that, you're also helping everybody stick together, because you're sharing vital information that is personal, that derives from your experience, that can help somebody else get a greater understanding of what's going on with them. So that's what I would recommend. Great question. And we got to stick together. We definitely have got to stick together. Question number 2. My therapist general, I think you mean it's a general therapist, not a gender therapist, perhaps, I'm assuming, has gone through the journey and knows that I'm trans and non-binary, bigender, okay? He tells me that all of Texas is rough. He tells me that all of Texas is a rough place and that I have to toughen up. Socially transitioning feels great, but people still see me as a man, but I want them to see me as a woman. People who disregard my pronouns make me feel invisible. It's gotten so bad that I start to tear up when people call me sir. It's not euphoria. It hurts mentally, and I try to stay strong. Does that mean that I should make steps to transition? So right off the bat, I'm a little bit confused with the question, because you say that you're trans and non-binary. When you say bigender, bigender usually implies both of the genders. Non-binary implies not exclusively male nor female. Transgender implies other than gender assigned at birth. So I'm a little bit confused what your gender is, because you indicate trans and then non-binary and then bigender. So I'm seeing like 2 things, and which immediately make me think that you are perhaps more like gender fluid. But then you also say that you feel very uncomfortable when you're being gendered male, and you are wondering if you should transition, if you should start transition other than social transition. And you say that people still don't see you as a woman. So, okay, let me make assumptions here, if you allow me. If you identify as a trans woman and you're only socially transitioning right now, and when you go out there, the world still genders you male, that is very difficult and very challenging. And yes, it is not going to give you euphoria, it's going to give you dysphoria, it's going to exponentially increase your dysphoria. The question is not whether you should take steps to transition, but the question to ask yourself, what other avenues of transition are you thinking about? Why you're thinking about them? What benefits you think they're going to bring you? how do you think they're going to help you? If you are not a trans woman, and if you are non-binary, then also ask yourself what transition is going to give you beyond your social transition, because again, this is not exclusively male or female. And so when we're considering surgical and medical interventions for non-binary individuals, it becomes not so sometimes not so easy to figure out which paths to take or which elements to engage with. So it's hard to answer your question because I'm not exactly sure how you identify. Texas is a very challenging state right now to reside in because of all of the anti-trans things going on. I personally think that, you know, when we say toughen up, and again, I don't have context how your therapist said it to you and how they elaborated on that. So, but just in general, when we say you got to toughen up, it may sound logical and it may sound like a good approach, but to be able to toughen up implies a lot of things. It's to be able to, what does it mean? Does it mean that you have to get in touch with your resilience? Does it have to get in touch with your strengths? Does it mean that you have to cultivate a sense of powerfulness versus feeling disempowered by society? It could mean a lot of things depending what is it exactly that yanking inside of you every time you get misgendered. What I see is that this issue is affecting you a lot, being misgendered, I mean. And I think that there is a work that potentially you can do around it in the therapy. Again, I'm rambling for the words because your question is not clear to me. So I can see how my answers are also incoherent to you. If you want to rephrase your question and resend it to me, that would be great. But in the meantime, I'm not sure how to answer for you. So yeah, I wish you all the best, but feel free to send it to me if you want me to reformulate it. Question number 3. Hello, Dr. Z. Sometimes I feel so femme and want nothing to do with being male. I want to be a woman. Sorry, I'm reading this. I feel so femme and nothing to do with being a male. Okay. I want to be a woman so bad it hurts. Then other days I wake up and feel so much like a guy. In my mind, every day I drift to wanting to be a woman. But male activities seem to be what I want to do. I am 58, lifelong crossdresser, and do not mind boy parts down there. It would be nice to get rid of my testicles. I do want breasts. Being married makes that very hard to do. Do you think that my natural hormones play a part in how I feel day to day, more male or more female? So this is a great question, right? So you think that day to day, sometimes you feel like being more of a female, but at the same time, you feel comfortable with, seems to be comfortable with most aspects of your physical body. And you also want to continue to engage in male activities, which, by the way, you can remember, we're gendering the activities. The activities are really don't know gender. If you want to sit in a chair and do crochet, the crochet doesn't know gender. It is us humans who attribute gender to it. A lot of activities, if not all of them, not even a lot, I would say all of the activities are pretty much genderless. And like I said in the other video, one can have activities and interests and passions that may stereotypically on the surface appear like particular gender presentation, but not necessarily in alignment with your gender identity. That's totally fine. I actually encourage that. I think that's a great thing. I don't want people to be slaves to stereotypes. Now, your question is, could hormones play a part in how you feel day to day? Yes, absolutely. Testosterone is an active hormone. It is pretty much a very, I always think about testosterone as like fight or flight type of hormone, go, go, go. And estrogen is definitely different. And hormones do play a huge part in how we even perceive things, how we feel toward things. We know this for a fact because numerous people want to go on estrogen, describe a sense of calm, describe feeling differently, describe even being more receptive. So we definitely know that the hormones have capacity to make us feel differently. To what extent, in your case, hormones specifically contributes to this, I don't know. What I think is important for you to figure out is what are those instances of dysphoria are telling you more about your gender identity? How much of this is maybe that you're comfortable with your gender identity, but you're struggling with also incorporating other elements of gender expression and gender role or gender interests, or accepting those gender interests while you're feeling all of that. So I would definitely explore all of that if I were you, versus just, going down the road of assuming that it's hormones. It could be, but it's also would be impossible to fully tell you if it is hormones or not that are playing the part. But I definitely feel like there's more exploration that can be done here, and I would encourage you to do that. Perhaps maybe there's a local therapist where you're at where you can do this exploration. That's what I would recommend for you. Good question. I wish you all the best. Question number 4. Hi, doctor. I feel good with my body, but I don't feel comfortable. We have a lot of questions today about kind of body dysphoria, social dysphoria. But I don't feel comfortable only with my genitals. What does it mean for me? It's for about 30 years. I'm 37 years old. So for about 30 years. So you're basically saying since you were 7 years old, you felt uncomfortable with your genitals, but comfortable with the rest of your body. What does it mean for you? It's funny, I feel like today's Q&A is going to be a lot of I don't know. And it's not that I don't want to answer your question. It's just that I'm very transparent about instances when I genuinely feel like I don't know, versus coming up with some kind of intellectual mumbo jumbo answer for you, because I don't think it's fair for you, and it's not going to serve you. It's not going to serve anybody. So it's hard to say. It could mean a lot of things. I'm going to say this. Not everybody who's feeling genital discomfort necessarily has dysphoria that is stemming from gender identity incongruency issue. Some people may, some people don't. It could mean a lot of things. It could just mean that you're deeply uncomfortable with your genitals. It could mean that you have associations to your genitals that are negative. It could be culturally inclined. There could be a lot of things here on the table. To say that, oh, you have been feeling discomfort with your genitals for 30 years, but feeling very comfortable with the rest of your body, that means you're transgender, is to me, again, very reductionistic. So in this case, if I were working with you, I would explore with you your relationships, and you are also mentalizing associations to what genitals mean to you and what they stand for and what they represent to you. And especially the instances when you feel discomfort with them. What are those instances? Are those instances during intimacy? Are those instances during when you're using the bathroom? Are there instances when you, for example, maybe engaging in masturbation? What are those instances? What level of discomfort do you feel? What comes to your mind? All of those things, in my opinion, have to be explored to be able to provide you with an answer that is going to be one that can encompass what you're experiencing and what you're going through. Yeah, I feel like, I'm sorry, today's Q&A is going to be, I don't know. I wish I knew, but sometimes the context is missing, and sometimes there's not much going on for me to formulate hypothetical guidance, hypothetical answer, other than in your case, just like with another person, I would spend more time exploring your relationship and what is the discomfort is telling you about yourself. Question number 5. So happy someone brought up transitioning as another way of coping. It's been on my mind as well. That was in one of the videos. Your answer did bring up something else that is always circulating through my mind, since hormones is making changes to your body's natural chemistry. Yes. What are the health risks that someone may encounter? If you covered this in previous video, I apologize, but long-term health is something that as I get older, I'm trying to be less more aware of. Great question. Part of it is also going to be, I don't know. So here's the thing. First of all, it's important for everybody to consider health risks in regards to hormones, for sure, because you're going to be on a hormone, taking hormones for the rest of, for a lot of people. I would say they take it for the rest of their life. Some people they take and they stop when they achieve what they need to achieve, or sometimes people's gender identity shifts. Sometimes people just take it for a short period of time to achieve certain secondary sex characteristics. So it's really important to think about health risks of hormones. I won't be thoroughly answer this question because I'm not a medical doctor. I will answer this question in this way. Are there health risks to hormones? Yes. This is something that we all know. However, having said that, the risks of taking hormones are going to be different for everybody. And that depends wildly on your age, on your health, on your genetics, on your health history. I mean, there's so many things that go into it. For some people, the risks are almost non-existent or none. For some people, the risks are minimal. For some people, the risks are big. For example, venous thrombosis is a serious risk, and it's a dangerous one for individuals who are a particular age group, especially people who are smokers or have history of smoking. So there's definitely health risks, but the risk is going to be going from almost non-existent to potentially exponential, and it's all going to depend on you and your history. And that's also why it's so difficult to answer this question, because it's not one of those medical questions that can be generalized to everybody else. But the risks are there. I mean, listen, trans guys who are taking testosterone are now starting more and more to talk about vaginal entropy and how painful it's starting to have to feel, to experience sexual intercourse. For individuals who decide not to have genital surgery. So there's definitely different types of risks for different types of people that occur. And I also gotta say is that we, as I would say, the transgender medical field, I feel, still doesn't have very broad longitudinal studies of individuals. And it makes sense, right? People start their medical and surgical transition, and then when they feel like they have achieved their goals, they move on with their lives. A lot of times, in my experience, people don't want to involve themselves in follow-ups, in any kind of studies or service. They want to forget, frankly, for a lot of people, their trans history, in the sense not of being in denial, but in the sense that, hey, can I just focus on my life right now? Dealing with dysphoria for majority of my life has been enough. Let me just move on. So to find people that we can follow up longitudinally in terms of hormones is challenging. I think it becomes easier when people come to doctors for medical attention when they're experiencing some of those issues. And yeah, it's not an easy answer, but I would recommend for you to talk to a medical provider and find out, given your history and your context and your genetics and everything else, what are potential risks of effects of hormones on your health long term, and discuss it with your doctor. And you know what? Don't be surprised if your doctor is going to say that, given your history, here's some or none risks, but long term, I can't tell you how it's going to happen. We're just going to have to wait and see. A lot of this is kind of, I wouldn't say that gender affirming care for adults is experimental, the way that word is being thrown around for use. It's definitely had been using hormones for many, many years. But I would say that it's maybe not as thoroughly looked at as perhaps it could be. But we obviously have a lot of people who've been on hormones all of their lifetime and they feel in excellent health. And then we have people who don't. So it's also to find causality. What causes what may not be as black and white, and that's another thing to consider. At what point the potential things that you're experiencing are actually stemming from taking the hormones. But great question. The endocrinologist I interviewed, Dr. Christine Viriaga, in my Dr. Z interviews, she's solely focused on working with transgender non-binary individuals. I heard that she is planning to start her own podcast, and I really hope she does, because my God, wouldn't that be amazing to have actually a medical doctor talk about all of this and actually give a much more depthful answer than the one I'm giving all of you right now. And I'll keep you all posted, by the way, when she starts the podcast. Question number 6. A question, or maybe an observation, I've noticed in starting feminizing hormones several months ago that I haven't seen addressed on the channel directly. I never wanted kids. I don't have children, and I love my nieces and nephews. But when I think about how my life could have been in another world, where I was born cis woman, I can see myself wanting kids. And I feel an intense sense of grief that I can't bear a child when I think about that. I still think that in that hypothetical or for practical reasons, a job, finances, I might still have decided kids weren't for me. But I still feel sadness that this isn't even an option I have. There are other options if I have wanted them as a trans woman, but this don't appeal to me in the same way. So here we're talking about, by the way, this is a great question. Here we're talking about an inner desire to mother and to mother, I wouldn't even say mother, an inner desire to actually have capacity to birth, to have the reproductive organs of the female, to be able to birth a child. And you're not alone. I had people who felt the same way that you do when they think about being born into this life, having that capacity. They get a striking sense of grief, a sense of sadness, and it can be very difficult for a lot of people. Sure, adoption is there. There's so many ways to mother, right? You don't even have to mother a child to experience the nurturing archetypal energies of being the mother. I don't have kids, don't have any interest of having kids. I feel that a lot of times on this channel, I am also holding the archetypal energies of nurturance and mothering without being a mother. So sure, there's other different ways you can get in touch with those energies, but I also understand that it's not the same as actually feeling like you have that capacity, that is something that you possess. I think that a lot of people who feel this way, in my experience, they often feel like something has been taken away from them, or they often feel as if there's a sense of disadvantage, always feel a sense of incompleteness, I would even say. And even if you don't want to have children, like you said, in the future or not, just not having that capacity can feel that way. That is something to explore too, where's that capacity is coming from? Are there any kind of latent content in relationship to that capacity that you're not aware of, that by becoming more conscious and aware of can help you with the situation? Certainly a lot of cis women don't have capacity to birth children, right? But I know that also knowing that doesn't take away the pain and the grief that you yourself feeling, because pain and grief is individualistic, right? And so even knowing that perspective is not always helpful. What's important is perhaps for you to sit with that feeling. What is it telling you? It could be that it feels like literally on a literal plane, it's telling you that you wish you had that capacity, but subliminally, if you dive in through the self-expression, you could find out that it's telling you something else. This is a great question, and I know that a lot of people feel this way. I know that a lot of people feel this way around other aspects of biology, other aspects of physicality. Yeah, it's I'd be curious to know what comes up for you when you sit with it. Does the feeling of incompleteness comes up? Does it feeling of, because I don't have this capacity, I am the other comes up? Could the inner transphobia be entangled into this? All of those things are going to be really important to explore, and you won't really know until you sit down with this and dive deeper in the exploration. So yeah, so that's what I gotta say about this question. Great questions for today. I again apologize to question number 2, that I couldn't give you a really good guidance or give you really good support because I couldn't really understand your question. Again, feel free to resend me your question and modify it. Other than that, comment below, let me know what you think, share your thoughts, share your experiences, and if you have a question, feel free to email it to me or feel free to comment below and leave it below. And I'll see you all next time. Bye.